As cameras flashed and the world watched, America's Vice President Kamala Harris received her COVID-19 vaccine back in December as part of efforts to build public trust in the widely speculated vaccine. And for the registered nurse who had the task of administering the vaccine to the 49th Vice President of the United States, who is also the first woman and a person of color to serve in that role, it was a job she did not take lightly. That registered nurse is Patricia Cummings, who is Guyanese. RN Cummings, who is currently in Guyana, shared her experience administering the jab to America's VP.
For being chosen to administer the first vaccine to Madam Vice President Kamala Harris was truly a surprise, but as I said, it was truly an honor. And when I was told that I was chosen, I was asked to give a small bio of myself. And I was sure to mention where I came from.
The 37-year-old, who works as a clinical nurse manager at United Medical Center in Washington, D.C., was on Monday honored for her role in participating in that moment in history by the Georgetown Mayor and City Council. Mayor Ubraj Narain presented the RN with a token of appreciation for what he dubbed as representing Guyana and its people with excellence.
I was a Guyanese to administer the vaccine to the first female Vice President, Kamala Harris of the United States of America. It's a pleasure for us here as Guyanese to see one of our own had reached to that level.
Touching on the ongoing pandemic, which has claimed the lives of 507 Guyanese and 608,000 Americans to date, Cummings sounded a timely reminder that COVID-19 should not be taken lightly.
It is no respecter of persons. You know, it doesn't just affect the United States of America. It doesn't just impact Guyana. It impacts this entire world. And so my messaging is for anyone listening, my fellow Guyanese, we need to do our part, continue to do our part to be safe.
She stressed the need for Guyanese to not drop the ball in the COVID protective measures.
That we're taking the necessary precautions, that we're washing our hands, doing our social distancing, and we have to wear our mask and where feasible to get vaccinated. Okay, that is the only way that we're going to stop the spread of this deadly virus.
Born in Guyana, Cummings migrated to the U.S. 20 years ago. Following in the footsteps of her aunt, she decided to enter the medical field herself. 15 years has elapsed since Cummings took that leap of faith to become a nurse. She is currently working towards her Master of Science in Nursing degree at Walden University. Reporting for the HGP Nightly News, Amel Griffith.